Stop the recording.
Do that over here.
There.
Yes, she is. Yes, she is.
Thank you.
And so is Laura Wimmer and Diane Walters.
Great.
Okay. All right, we're going to go ahead and get started. Welcome everybody, to those here in the room, and then those of you on Zoom, welcome aboard. And we're looking forward to having Ann Thomas, who's president of the Diablo Valley chapter, Hearing Loss Association chapter in California. So welcome, Ann. I'm going to let you take it away if you don't mind. And anybody has questions on Zoom, Ann will explain how to handle that. Thank you and welcome.
Thanks, Kathy. Hi, everybody. I'm so excited to be here today. I've given many presentations to the Diablo Valley chapter and other chapters in California and throughout the United States since we were able to do Zoom. I think that this is one of the most important presentations I've ever given. And I think this is like the 6th or 7th time that I have given it. And I'll explain why I think it's so important as we proceed into the presentation and our discussion. Before we get started here, I would like to have everybody become familiar with, hang on a second, I just got a new pointer. Familiar with how to use the Zoom directions on your computer, the icons. So if you look at the bottom of your screen, you'll see the Zoom menu bar. All the way to the left is your audio. It's the symbol of the microphone. And I just clicked on a pop-up button that's showing you exactly where that is. And so by default, many people set the audio for the audience and people in Zoom on mute. So if you ask a question, please make sure to unmute yourself, and that's where you'd find that. The next thing that you need to be familiar with is the video camera. So at the beginning of the pandemic, I attended an HLAA webinar, and it was just like, the first few times that all of us had been Zooming, and one of the participants, a woman, forgot that she had her video on, and she proceeded to take off her shirt and was sitting there in her bra. So it's a reminder to everybody, if you're going to do something that you don't want the world to see, remember to turn your your camera off. And when they're off, what happens is a red line goes through them. So it's very easy for you to see that. I believe that Kathy's allowing everybody to chat, and you can say hello to your friends. You can ask questions. Jean is there probably to help with the technical information that people may be stuck with. Probably the most important thing for all of us in this meeting are the closed captions. And I'm able to see into your room, so I see the captions are going there for everybody. On Zoom, I can't see what's happening for all of you. So I would like for all of you to know that there's a caret, which is a forward-facing arrow. Looks like this, next to the CC icon. When you click on that arrow, there are additional choices for you. One of them is view full transcript, and the other is subtitle settings. The view full transcript option can be especially helpful for those of us with hearing loss. So Zoom only captions approximately 4 lines, which I'm thrilled we get this right on the screen that you're looking at. But sometimes I know for myself, I didn't quite catch something. And I know that I didn't catch it because the next sentence doesn't fit with what I thought I understood. So if I have the full transcript turned on, there's a floating window on the screen, and I can quickly scroll up or scroll down in that transcript and read what it was that I missed, and then come back to reading the transcript on the screen. The subtitle settings are important because you at home who are on Zoom can adjust the size of the captions. So I generally have mine set to the largest size because it's easier to read. The next thing we'd like to ask is that you raise your hand to ask a question. So Zoom has finally separated out. Originally, it used to be in reactions, but now they separated it out as a complete option for itself, so it's much easier to identify. So in reactions, if somebody says something that you like or don't like, or you have some opinion about it, you can click on any of the emojis in there and we'll be able to see that on the screen and be able to understand that you are communicating without interrupting the presentation. I create a special slide deck that has a black border at the bottom because what I found was when people are giving presentations, the captioning box was floating over the slides, so you couldn't see what was actually on the slide. So for those of you on Zoom, you can take your caption window and slide it into that location, that black location on the slide that you're seeing, and then you'll have full visibility of the slide deck. So that's all for the Zoom directions. And now it's time for us to move on to the presentation today. Before we get started, I'd like to know some information about all of you who are present here. The first thing I'd like to know, and I'd like you to raise your hand, and Kathy's going to be monitoring Zoom to give me an idea and tell me how many, approximately how people answered and also in the room. So the first question is, do you have problems understanding speech sometimes? Are there some situations where you have difficulty? So Kathy, how many people do we have here? Is it almost everybody?
We have 16 on Zoom, 17, one just came in. And I do see some hands up. What I'm having trouble is just trying to figure out how I'm going to see the hand, because right now you are pinned as the main um, window, I
Kathy,
guess,
If you,
picture.
Kathy, if you open up your participants window, when people raise their hand, it shows in that window.
Yeah, it does. I see it now. Yes.
Okay.
So hold on here. I'm going to make that smaller because that was too big. Trying to make it, okay. For example, I see not everybody has identified themselves. So a phone number 314 has raised their hand, and then Linda Baker has her hand up. And let's see, how do I see the rest of them?
You could scroll it.
Okay, that's what I was trying to do, and it's not letting me scroll too well.
Okay, so I'm seeing hands raised, and I'm seeing that most people in this meeting think that there's sometimes that they have problems understanding speech. And I assumed that would probably be the answer, but I just wanted to get a gauge of who was present today. So the next question I want to know the answer to, and this I don't have an idea about, do you routinely ask for communication access? So when you go to the doctor, you go to the hospital, you go to the bank, you go to your theater, you take parks and recreation classes for your city, do you ask for communication access? So Kathy, how many people do we have? Is it most people or not very many people?
I see 3 people have raised their hands.
And what about in the room?
Okay, anybody raise? Okay, 1, 2, 3, 4, 5. 5 people, 6 people are waving their hands.
Oh my gosh, I am thrilled. Most of the time when I've given this presentation in the past, everybody is saying that they have problems understanding speech in a variety of situations, but nobody's asking for communication access. And other than when I've been giving this presentation with my other friends and other people I know who have hearing loss, most people aren't asking for communication access. So they're either making do, bluffing, or they're bringing one of their own devices. So what are some of the obstacles that we might have for speech comprehension? And since this is an HLAA group, the chances are really great, unless we have some new people, that everybody's going to know the answer to this. So the first one is the distance from the sound source. How far away from the person who's talking or from the loudspeaker in the ceiling are you? So hearing instruments, which is hearing aids, cochlear implants, and bone conductive devices, have a limitation of about 6 feet. And you know, that's not very big. So if you put your arm out and somebody else puts their arm out, your arm's 3 feet, their arm's 3 feet, that's about 6 feet. So anybody outside of that range is going to have problems understanding. Now there's one exception to this, and that's if you have mild to moderate hearing loss, you still have a lot of residual hearing. And because you have a lot of residual hearing, you're not relying on the hearing instrument for all of the amplification. The next thing is reverberation or echo. So anytime you have reverberation or echo, it distorts the sound and it makes it harder for us to understand. Of course, we all know this, right? Competing background noise is our nemesis. Face masks. Boy, did we learn that during the pandemic, right? If we thought we had a hard time before, I've read statistics that say that a face mask can decrease the volume of the sound by as much as 20 decibels. And safety shields. And when I say safety shields, I mean those glass plastic shields. And in some locations, they had those prior to the pandemic. And that was to provide safety for people who were in information booths and things. And see, that glass decreases the transference of the audio sound for us as well. So we have all of these things that are limiting our comprehension. During the pandemic, for those of you who don't already know me, I got 2 very successful cochlear implants. I never thought that I would ever hear this well again in a wide variety of circumstances for the rest of my life. Needless to say, I am happy and delighted beyond the moon. But I'm still a hard of hearing person. When I take my processors off, for all purposes, I'm deaf. So we have an espresso maker at my house. I can't hear and everybody knows how loud an espresso maker is, right? I can't hear the espresso maker, but if somebody slams a door, I can hear the door slam. So I mean, I have just a tiny little bit of residual hearing. I still have the same problems people have with accents. I have the problems that people have by distance. So my whole language in and about how I talk about hearing loss changed, because some people would interact with me and I would be interacting with them like I didn't have any kind of a hearing difficulty. And then something would happen. So it was jarring for them. They didn't understand how to react and relate to that. So what I've started saying, and it applies to all of us, is that we really live uncertain lives. We never know when we're going to be able to understand and when we won't. And so we need to be prepared. Generally, I think that we have a tendency to think, oh, I'm doing fine, so-and-so. I don't really need that. If you don't prepare ahead of time, what happens is by the time you get to the situation and find out that, oh my gosh, I can't understand here, it's too late to ask for the accommodation you need. So I really want to encourage everyone, please don't feel guilty about asking for an accommodation that you need ahead of time. And if you get there and you actually don't need it, just be happy in that circumstances that you didn't need it and don't feel guilty. A lot of people don't think that hearing loss is a disability. So this is a question to you. do you think hearing loss is a disability? And just to think about it for a moment. In fact, it is a disability. Their disability, and the disability rights are civil rights. A lot of people don't quite understand that being able to get disability access is the same thing as women having the right to vote. It's a civil right granted to us in the United States. There are many civil rights laws, both state and federal. And previously I'd given this in other states, so I looked up to see what you had in Missouri. And in Missouri, you have the Human Rights Act that was passed in 1957 that covers people with disabilities. And that was updated in 2017. Now, almost all of these state laws model federal laws, but they may have more they may be more inclusive. And an example of that is in California, there's no business that is excluded from the disabilities rights laws. And in the federal laws, churches were excluded from complying with civil rights laws. The next civil right law that you might want to become familiar with was 1973, Section 504 of the Rehabilitation Act, Section 508 of the Rehabilitation Act. And these are both applying to federal agencies. We have the Fair Housing Act. That was in 1988. It was amended to include disability. It was originally designed in 1968. And the one that most of us are familiar with, which is the Americans with Disabilities Act, and that was passed in 1990. So we've established that hearing loss is a disability, so everybody needs to ask for communication access. And this year, the ADA is 34 years old, and unfortunately, people with hearing loss are the stepchild of the disability movement. And I personally believe that we really need to do everything in our power to change that. The ADA is divided into sections, and these sections are called titles. The first one is Title I, which covers employment. Title II covers local and state government. Title III is public entities, which would be your bank, could be your movie theater, could be your grocery store. Title IV is telecommunications, and Title V is a miscellaneous category. Where? Everywhere. So I picked the icons on this slide so that they would be easily identified for most of us to get an idea. Maybe there's some things here that you never thought about. So going to the museum, going to a graduation, a grade school, middle school, high school, university graduation, theater, a presentation, at the airport, transportation, in hospitals, at the pharmacy, in the grocery store. So it's really just about everywhere. But what's required? The language of the ADA states that communication with people with hearing disabilities is equally as effective as communication for people without disabilities. Now, what's required is auxiliary aids and services. And they specifically created that language because everybody is not the same. So people with hearing loss is a spectrum disorder, and one size does not fit all. We have the deaf community, whose primary means of communication is American Sign Language. We have late deafened people who are like me. I have a cochlear implant. I can rely on captions, amplified devices, and other things. People with severe hearing loss and mild to moderate hearing loss. And many of you here today may have started out having mild to moderate hearing loss like I did. And so you may know the full spectrum of experience and be able to have a sense of how that's changed over time for you. So while you're thinking of, how that would apply, the ADA maintains that the keys to effective communication and what would be required is the nature of the conversation and the length. So I'll give you an example of what that might be. So obviously, if you were asking someone, where is the restroom? And they would reply, down the hall to the right. That's not a very lengthy conversation. And I'm going to say it's not all that, as important as going to the bank. So what's required is less than something more important. So the complexity, if it's very complex, the context of the communication, and they're supposed to pay special attention to the person's normal method or methods of communication. So to ask you what's best for you. So some of the ways that communication can happen when it's not very long or not very complicated is you could use a whiteboard. Whiteboard is a great tool. Somebody had an information counter on a whiteboard, and you walked up to them and you said to them, where's the restroom? They could easily write on a whiteboard down the hall to the right, and you would understand that, and that would have been effective communication. Somebody could use paper and pencil. Now, I have to tell you, I really don't understand this. It doesn't make any sense to me. But somehow when you tell people or when I have told people that I'm hard of hearing and I can't understand them, would you please write that down for me? They have a very difficult time understanding that. So you may have to repeat it numerous times. You may even have to tell them, if you write it down, I can read it so I know what you're trying to communicate to me, but I can't understand you. I can't hear it. And during the pandemic, some wonderful infographics were produced. The one that's on the left here was created by the Massachusetts Commission for the Deaf and Hard of Hearing. And they did that because they recognized that with face masks, we had a terrible time understanding them. And so the images that they picked, I think that this is such a good infographic, and I use it whenever I want people to think about how they could use infographics in their business or hospital situations. So somebody asks you, how do you feel? And they point to the question, you can easily point to the answer. What's your situation and history symptoms? You can point to these things. That's a rudimentary kind of communication, so people could have an idea of what's going on. Now, as soon as we're finished with these kind of not lengthy conversations, what's required to be provided is more complex. So the auxiliary aids and services could be a personal amplifier like a pocket talker. It could be an assistive listening system. It could be captions, CART, which we're having today. Thank you very much. And it could be an interpreter. Now, frequently it's an ASL interpreter, but there are also other interpreters that you can have who have been trained to articulate well to be able to assist us with lip reading. So this is what a personal amplifier looks like, in case you haven't seen one. This is what I consider to be the premier amplifier. It's made by Williams Sound. It has a T-coil built into it so that somebody could also use this for a receiver in a location that had a hearing loop. It comes with, we're showing here, headphones. You also see a neck loop. A neck loop would be what's used by people who have telecoils in their hearing instruments, which I hope everybody here has, because that's the only way that you can easily connect to any kind of device or assistive listening system, because headphones and hearing instruments don't work well together. Frequently you get feedback, and the microphones for hearing instruments are on the top, or even some cochlear implants, they're in the back. And so the microphone for headphones was created to go into your ear, and that's not where the microphones are for hearing instruments. Now, if somebody didn't have any hearing instrument and they wanted to use one of these devices, if they wanted to, they could bring their own earbuds. Then they wouldn't have to worry about any kind of hygiene issues. Now, assistive listening systems, I'm assuming that in the room that you're in, you have one, but I forgot to ask Kathy. So the granddaddy, the greatest assistive listening system that we have had up to this point is a hearing loop. And why do we love it? Well, we love it because we don't have to identify to everybody that we have hearing loss. If a place has a hearing loop, you walk in, you activate the telecoil program either by buttons on your devices or via a remote and an app on your phone if you're lucky, and you're set to go. Maybe not very long ago, maybe just 5 years ago, you had to determine how you want that telecoil program set. It could be set so that it was telecoil and microphone, all telecoil, or a special other program. You could have as many different varieties of telecoil settings as you wanted to. And the reason for that was because there wasn't a way to adjust the balance between the microphone and the telecoil for the individual. But that changed when they created apps for hearing instruments that you access via your smart device. You can now adjust whether you want, how much microphone you want, how much T-coil you want, and you just move a slider. Now, this is especially important because in California, Northern California here, we have a train system called the Bay Area Rapid Transit. And starting in 2016, we advocated for hearing loops for the new train cars and also for all of the information booths. And when we did the pilot program and we went to the station, what happened was all of the people who had telecoil and mic, because this was before you could adjust it, the hearing loop was not beneficial to them because the microphone setting picked up all of the extra noise in the train station. I mean, everybody knows train stations are really loud. Well, I happened to have two programs. I had one that was telecoil and mic and one that was only telecoil. And so the program that was telecoil only, it worked great. And I'm very proud to say, as a result of our advocacy efforts, all 755 of the new BART trains all have hearing loops in them, and all of the agents' booths in all of the stations in Northern California also have a hearing loop. Another kind of assistive listening system that you may be familiar with, in California, lots of places installed this because it was easier. But we don't like it as well, and it doesn't generally work as well, and that's an FM assistive listening system. And an FM assistive listening system works on a radio frequency. You know, FM radio, well, that's what this system is like, but they designated a certain FM frequency for it to transmit on that the normal radio cannot do. Now, everybody with this system has to get a receiver and a connector. So that means you need to allow extra time before the performance, before anything you're going to do, to go figure out where those FM receivers and headphones are. Usually you have to give them your driver's license or something so that they feel like they could contact you if you forgot to return it, or to ensure that you return it. And there's batteries in those receivers. And it's been my experience that no matter how many times I tell them to ensure that the battery's charged, the batteries die in the middle of exactly why I went to an event. So I've had some very bad experiences with FMs from that perspective. An infrared system everybody here is familiar with because that's what the remote control is for your TV. And so it runs on an infrared frequency, which is light, And so, as you know, if anything comes in front of that light source, you don't get, nothing happens. So if you're at a performance and they have an infrared and somebody stands up in front of you, it disconnects the system so you don't hear what was said, in addition to all the problems with the receivers. When the ADA updated the Americans with Disabilities standards, and the standards are all the designations for how the ADA is to be interpreted with technology and things. They mandated that all assistive listening systems now need to provide neck loops so that they're hearing aid compatible. If you go to a location and by some chance they have an FM and they didn't pay attention to the 2010 standard upgrades, they may not have a neck loop. And I would very strongly tell them that they're required to do that, and I would follow up with them to make sure that they did that in the future, because you can't use whatever they have very well without one. Captions. Well, we love assistive listening systems, and we love captions. So there are a wide variety of captions. There's communication access, real-time translation, which is a gold standard, which is what we have today. Thank you very much. You can have that in person. And if it was in person, that means a CART provider would be sitting in your room captioning what's being said. Today we have remote CART. Oh, excuse me, I think it's remote CART because she connected to us via Zoom. And so in remote CART, the person can be anywhere in the United States as long as they have the capability of being able to hear what's happening in the room and a way to be able to have that be projected, which is what we have today. There are also captions that are closed captions or open captions. The difference between them are they automatically on the screen, or can you turn them on and off? And if you look on to the right there and you see those images, the one image on the big screen is an HLAA convention, and they were using in-person CART. And there also happens to be an ASL interpreter, the woman on the right there. We have something new, wonderful, and it is improved beyond what we all could have ever imagined when it first came on the scene, and that's automatic speech recognition. I happen to use the app that's called Ava, and of all of the automatic speech recognition apps, it's the most robust because it allows you to communicate as an individual conversation with more than one person at a time. So during the pandemic, you could maintain social distancing of 6 feet. So a person would be connected to Ava, they're 6 feet away, and you're connected to Ava. And the way that you can tell there's more than one person is that you get little icons at the top showing how many people are involved in the conversation. And I believe you can have up to 12. They have it on your phone, on your tablet, on your computer. So really on everything. If you have an Android, Ava works on an Android or iOS. If you have an Android, you have access to an ASR captioning app that's called Live Transcribe. Live Transcribe is loved by people who have Android devices, which I don't happen to have. And it's very accurate. The only thing that you have with Live Transcribe is it's only captioning what one person within the distance of that microphone is saying. If you don't have either of these apps, I highly recommend it. I don't know what I really would have done in the pandemic without my Ava app. So with Ava, you're allowed to rotate the phone. So the microphones are on the bottom of the phone. And generally that's where you put your hand. So there's a chance that your hand could cover up the microphone. You can rotate the phone so that the microphones are at the top. And I would turn my Ava on when I was going to the grocery store. I would identify to the checker that I had hard of hearing, and I was going to be using an app on my phone to understand her or him. I would reach my hand out with my phone in it so that the microphone was closer to them. And I would tell them, see, it's captioning what you're saying. I never had one person respond negatively. Everybody was absolutely amazed that that technology existed because they hadn't seen it before. Translation. This image here I took at the 2010 Walk for Hearing in San Francisco, and I have absolutely loved it. It captured the beauty and elegance that can exist in ASL. And so I frequently use it. So the gentleman there is doing ASL of what someone is saying at the walk. There's also tactile interpreting, and that is for people who are deaf, blind, and it's beyond my comprehension how people can really understand this. They take the palm of your hand and somebody does things in your hand and the person is able to understand what's being said. And oral interpreting. And an oral interpreter is someone who's been specially trained to be able to articulate well and clearly to assist us auditorily and also with lip reading. And you can ask for that in lots of locations. Then the next question is, right, this is what my chapter members always said, and what the DV chat was so great. So we know you're telling us that we have these rights. They're telling us what we could ask for, but who do we ask? You know, how do we get this stuff? So the first person to ask for and to look for is an ADA coordinator. All state and local government is required to have ADA coordinators. Hospitals are required to have ADA coordinators. Your parks and recreation, your library, they're required to have ADA coordinators. In hospitals and healthcare, sometimes the people who oversee accommodations for people with disabilities is not where we think it would be. Frequently, it's interpreter services, and those are the same people that somebody would ask for American Sign Language. So, you know, and we always complain, right? When I tell them I'm hard of hearing, but I'm not deaf, why do they offer me ASL? So then that's an educational opportunity for all of us. Another place it's located sometimes is in patient services. And I'd like to remind everybody that any time in a hospital or healthcare setting that you get the follow-up informational survey about your appointment, and if you did not get communication access and you asked for it, please say the service they gave you was terrible. Those surveys are not actually conducted by the hospital. They're conducted by a third-party organization. And the hospitals, of course, want the highest ratings that they can have from those surveys. So if you don't say that your appointment and your service was terrible because you didn't understand, you have nobody to blame but yourself that it's not improving. And the last place that you might want to look for it is visitor information. You know, we all know that there's so many visitor information places, but there's even a visitor information probably at your senior center. So those are the places that you would think to ask for that. I'd like everybody to really think about this because we have an invisible disability. People can't see it. So I think it's easier to dismiss something that you can't see. But communication access helps us the same way that ramps help people with mobility issues. And this week I gave a presentation to my local Kiwanis, and I've given 3 or 4 presentations to them in the past, and I keep building on information from a previous presentation. And I like giving presentations to them because they give us grant money. So for those of you in the St. Louis chapter, that might be something that you want to think about. So when I use this slide this time, and I hadn't used it before, And when I did that and the slide was up on the screen, all of a sudden in the room, I heard everybody go, "Oh." And in that particular room, when I asked the Quanans, how many of you asked for communication access? Not one single person raised their hand. So this was a positive reinforcement for them to maybe adjust the way that they had previously been thinking about communication access. So I've given you an overview about what your rights are. Some people don't know what devices are available, and so they don't think about what to ask for. They go, well, I don't know what to ask for. And I've given you some basic ideas. And what the bottom line is, communication access is everybody gets the message. Everybody understands. And that's what our goal is. And we hope that we're creating hearing and age-friendly communities. So at this time, I'd like to open up the meeting to questions. And right before I do that, I'd like to draw your attention to the image that's on the left here. And that image was what's called the Capitol Crawl. It was March 12th, 1990. And this is what it took for people with mobility issues in the United States. I personally owe them a great debt of gratitude. I hope all of you in this room feel the same thing. They had to crawl up the steps of the Capitol on their hands and knees to shame our representatives into finally thinking that they had rights. If you look here, you see a 12-year-old little girl in a helmet. Took a lot of courage for all of those people to do that. And it's going to take courage for us to have the accommodations we need and to continue to speak up. So that's all I have to say today. And so I'm opening it up to questions. And Kathy, I'm going to quit sharing my screen so that then I can see everybody, okay? So if you have a question, we'd like to ask that you look at your toolbar at the bottom of your menu bar and see the raised hand and just click on it. And then Kathy, can you call on people?
Yeah, just give me a minute. I'm trying to get orientated. Somehow people keep popping up on this big screen. Is there a way to make it so we see all the gallery? And wait, let me try that. Well, that's everybody there, but trying to make it bigger so that we see everybody.
So Kathy, while you're doing that, I'm going to go ahead and look at some of the questions that were in the chat. So Donna Raymond, I see that you did a thumbs down. Would you like to explain what you mean by that so that we can understand you?
Oh, just that I wasn't aware of all the communication access that was available to me, and that I struggle in theaters, movie productions, plays, things that I don't really understand what's available to me, and now I know.
Oh, thank you. So this was valuable for you today.
Yes, because I find myself not going to different performances in that because I don't know that all this is available to me. Usually they just give me over the ear hearing amplification, which really doesn't, I don't know how to use it with a cochlear implant.
Yeah. So which cochlear implant do you have?
I have a Marvel Advanced Bionics.
Okay. So your I have advanced bionics as well. So you know your AB processors have telecoil capability. Do you have that program activated?
No, I'm going to have that added at my next visit.
Okay, perfect. And if you have any problems about that, just email me.
Yeah, I just was implanted last September, so I'm now just starting to getting familiar with what's available to me other than after now I've kind of learned how to, live with the processor and how to hear. And so with all these accessories now are coming on my next phase of being a CI user.
So Kathy, I think I know what you're trying to, oh, there, okay. So Kathy, on your
Yes.
side on that laptop, put it in gallery view.
I've been trying to do that and it's just.
It's
for
in the
some-
upper right-hand corner.
Yeah, okay, okay, so,
So
yeah, I
you-
see
You
gallery
have
and I hit
immersion
gallery.
view on the
and I
screen.
hit- Yeah, I'm hitting gallery and I get this weird thing that choose immersive view and,
Yeah,
I'm
so
trying to,
click on immersion view and maybe it'll turn it off.
okay, how's that? Oh, we're all sitting in chairs, that's weird.
Now we're in immersion view. Okay, so click on it again and turn it off.
Oh, this is weird. Anyhow, okay, I'm sorry, forgive me. Now what do I do now? Okay, hit view. Okay, I'm hitting view and nothing is happening. Why is, okay, gallery. Okay, and where do I hit? Try that one. Oh, that's weird. I'm sorry, we're trying to figure this thing out. This is all new to us. I've never had this happen before where we had, what do we want? Okay, what do you want?
Well,
Okay.
Kathy's fiddling with that. Somebody else asked, does the Williams AV Pocket Talker, does it only work with one's T-coils if they use a neck loop? Otherwise it's Bluetooth. No, sorry, no Bluetooth. And if one does not have hearing instruments, if one does not have a telecoil in their hearing instrument, then they use headphones. If somebody has a telecoil in their hearing instrument, the way you would use it is with a neck loop. Does that make sense to that person? Who was that? That's Harry. Harry, did that make sense to you? Okay, so Harry's also,
Yeah,
yeah.
yes, yes, thank you. It's too bad. I've not had good luck with neck loops. So that's frustrating. I don't suppose the telecoil or to have a hearing loop in a small device, it has to have some size to it to produce like the Williams PL90 tabletop or portable type device, which I bought one from Ginevra a couple months ago, and it's worked fantastic for me at work and meetings and so forth. I'd be glad to show that if anybody's interested, but it'd be nice to have a small little, handheld size. Yeah, there you go. That's it. You bet. This works great. If anybody has telecoils and you need something for a meeting space or one-on-one, and doctor's offices should have those. Anyway, yeah, it'd be neat if they had a small device that would work that way with not having to be so big, but thank you.
Yeah, so Harry, I'm looking at your other comment here about, if you'd like to contact me later about your local hospital, I'm on the Patient Family Advocacy Committee at the University of San Francisco Medical Center because I had such terrible time getting the accommodations I wanted when I got my CIs. And my hospital that's closer to me, I've advocated with them forever. I'm ready to sue them. I've never once got the accommodation I need. They even paid me to give them a presentation in their lunch and learn, and they still haven't done anything. So
Jeez.
if you would like to contact me later, I would share some of my experience on how to get to the right people for you.
Yeah.
That maybe you'll get something better.
Yeah, would you be willing to share your email with everybody? I might have it based off the Ginevra, the Loop Oregon group too. So
Yeah, so I'll put my email address in the chat so everybody
thank
can.
you.
Okay. So somebody asked how to get a copy of this. I believe it's being recorded, so you should be able to ask Kathy to have access to that. So in this one comment from Harry about Bluetooth, he talked about Bluetooth. I'd like to direct a little bit of attention to that. There are personal Bluetooth devices. William Sound makes a very good one, but they're one-to-one. It's not one-to-many. We have familiarity today with Bluetooth in our instruments to our cell phones. That's one-to-one. At this place in time, there is no Bluetooth in existence yet that's one-to-many. Just so, because sometimes people say, oh, I want to use Bluetooth, and it doesn't work for large numbers of people. So the question here is, did I say churches are exempt? So it depends on where you live. So in California, under the ADA, across the country under the ADA, churches are exempt. Unless they rent some of their space out and then they come under the Housing Act because it changed what they're basically doing in that sensibility. But in California, our civil rights laws say that nobody's exempt. So the California civil rights laws are stricter than the ADA. And I don't know what you have in Missouri about that. I didn't go into reading your civil rights laws, but I want to tell you the largest number of hearing loops in the United States have been installed in places of worship. So don't let that deter you. Okay. Michelle Frisbee, I see your hand has been up here for a while. Unmute yourself.
Yep. Hi, Ann and everyone. I'm chiming in from Fox Valley, Wisconsin, HLAA chapter, so a little bit far away from everyone. This hospital healthcare part of advocacy is really intriguing me, so I might follow up with you, Ann, also afterward. We're actually having a state conference in April in our Appleton area, and our focus is on communication access in healthcare, so, or lack thereof. We're trying to invite the medical professionals to attend so they can learn and we can help educate them and collaborate with each other. And it has been an extremely painstaking process to try to reach them. First of all, like you said, they're not always called ADA coordinator. They're buried in this little office, under another name or whatever. So it's been very difficult to even try to find the right people to invite. And I made a phone call to my primary hospital system that I've gone to for 30 years, and I literally could not find much on their website. And when I did try to call, I got transferred around to a couple different people. I ended up on somebody's voicemail, and that was a week ago, and I still have not heard back. So we're very frustrated. So it'd be great if HLAA, I know there's a healthcare task force committee, and I'm just thinking, like, I think it was Harry mentioned or asked about in the chat about creating a document or letter. It'd be great if we could get, just a one-page handout or something to be able to take on these appointments, not just about our personal needs at a healthcare appointment, but also to educate them on what they should be doing, with options of technology. Even if they have an iPad, you see all of these nurses now carrying around these iPads, and they always have computers there. They could just pull up a captioning app very easily. And I've heard of some hospitals having like pocket talkers or some type of device. So I'd love to collaborate more on that and see if we could get something going on that, because it sounds like it could benefit all HLAA and everybody across the nation.
So I recently participated in, did you know that there's an ADA network? It's a government across the country. Okay, so
we actually have, we have invited a representative from the ADA Great Lakes Network, and she's coming from Chicago area to participate on our panel at our conference. So I'm really looking forward to that.
Okay, so the Pacific ADA Center just had a 2024 conference on ADA requirements, directing part of it specifically toward hospitals. And I have a PowerPoint presentation that I can share with you. And I believe as part of that presentation, there are some request letters. So I'll be happy to
Wonderful.
engage in that conversation with both of you later.
Yeah,
the-
I
the
did see that
time-
conference.
Yeah, the time to, it's a shame you didn't attend. It was really very worthwhile.
Really? We thought about it, but it was overall ADA. It looked like it was like everything from mobility and everything. And
So
yeah,
you
we
can
just
pick
decided
which,
not to, but
so it's just like the HLAA convention. They had tracks. And one of
Okay.
the things that for me personally is always so rewarding is hearing the stories of other disability groups, because that raises my awareness of what we're part of. We're all in this together. And in many ways, our meetings, our websites are not accessible. And so it's
Yeah.
just raising the awareness to have a bigger goal to move toward.
right. All-inclusive design or whatever. Yep, good points. Yeah, if you could share any of that information that you're able to from that conference, that would be wonderful. And if HLAA, I don't know if you were representing HLAA on that or your personal desire, but it'd be great if HLAA, I hope they were there at that conference. I'm hoping, I would love to
didn't
see
think-
some kind of
I
takeaways.
requested that HLAA become a sponsor, and they agreed to do that. So we had a logo present for people to see. Ginevra, I suggested Ginevra become a sponsor so that she could advertise all of the locations that had hearing loops, and if people are interested in there, that they could contact her because theirs are successful. Harry's asking a question in the chat about Auracast. And
Go ahead.
I was hoping that it wouldn't come up because it kind of muddies the waters. But since Harry brought it up, I'm going to try to be very brief about it. I was HLAA's representative on the Bluetooth SIG for Auracast. So for over 18 months, I participated with them weekly on their cadence programs. The technology, Bluetooth SIG develops technology, but they do not manufacture products. So the technology has been created, and Bluetooth SIG is trying to convince manufacturers to put it into their products. At the moment, I think we only have one cell phone that is Bluetooth capable. We have a couple of hearing aids that are just beginning to get that. There are absolutely no locations that I know of in the world that have Auracast transmitters in them to be able to use that kind of system to even test it to see how it's going to work. So the amount of time that we have here to when it is going to be a possible usable scenario for us is certainly 5 to 10 years into the future. At that time, it may become very viable. I personally believe it's going to change the world for everybody, but we're not there yet. Okay, Win Wyman, your hand is up. And hi, Win. Win, are you going to talk? Oh, well, shoot.
Yeah, there. I had to.
Yeah, we're-
Hi everybody. I was expecting you'd call on Ted first. So his hand is up and has been up, I think, for a longer time.
Actually, he has multiple questions. I keep answering his questions from the chat. So you're
Okay. So
yeah.
I'm good. I didn't want to cut in line, so to speak. So, Win from Colorado, love the conversation. Always enjoy hearing you and pick up a couple more tidbits. And just wanted to add, I put some things in chat. So just adding to it, people, as I'm with Ann and we're on the National Committee for Hearing Loops. And a common question is, well, I don't know where the assistive listening is. I don't know where the hearing loops are. And it's a really interesting question because it's what Anne covered of every place that has a microphone in a public or a private place has to have an assistive listening. The signage might not be there, might not be on the website, but it's there. And so it's just a matter of sleuthing. If you can't find it, give them some feedback. If you want to start of where they are, I put some links in the chat as far as I manage the National Hearing Loop list. The same list is also on Google Maps, and so you can search that way. And it's there for you. So just reach out if you have questions or, whatever. So you have different ways of finding it. And then just adding to what Anne said, Auracast is just muddying it. And I'm starting to use the language of Auracast assistive listening, which is different than like a sports bar. And Auracast assistive listening, the specifications they're just beginning. So the marketing people for all the hearing aids are they're wanting to earn a couple dollars just as fast as they can. And they're not quite right in how they market things sometimes to say soon, and it's not soon. So that's it. And I'll just pop in if there's other questions and we'll go from there.
So Ted, I see you put a note in the chat. So
Yes.
now it's your turn. I didn't mean
Okay.
to miss you. I thought the questions were in the chat.
No, I understand. Now, can you hear me?
Yes.
Okay. Thank you so much for being on this telecast, number one. I have been an advocate for many, many years. I am with the St. Louis chapter. St. Louis, as well as the Indianapolis chapter. Thank you for your quick comment about Auracast. I appreciate that. I appreciate your civil rights of California. I'm going to have to check into Illinois, specifically those areas that you've mentioned. And then you mentioned branching out to other groups with disabilities. So I'm now being of aging, my mobility has been restricted. So I'm now involved in mobility support and learning a great deal there. So in a way, I'm doing less advocacy with hearing loss and more advocacy with mobility. And I'm amazed by what is needed in my area. So in the meantime, I do advocate and certainly pass out examples of what is it like to hear language. This has been very popular. You just gave me an idea, whether you meant that or not, is that I do have my handicap play card in my car, but I never thought to put on the other side the hearing loss symbol. So I'm going to put the hearing loss symbol in there somewhere in the car, so that is visible as well. I'd have to say with the hospital, it's been a real journey in terms of accessibilities and whatever. And I think the one thing that helped the most is that they catch me by surprise. Then I have no access to communication and whatever. So writing big notes, if you can, please let me put my hearing aids on before you talk, is my message to them. And so, yes, I do ask for American Sign Language. I ask for all kinds of aids. The classes that I attend is for academic, for lifelong learners. The police department said, now, Ted, will be happy to transport you whenever you need to, so you can participate in your conservation classes out in the grass. So I'm learning so much more wide how people are learning more about people with disabilities. And so we just have to keep talking.
Yeah. Ted, I have a suggestion for you on your card that you're showing an example of hearing loss. All the letters that you have in red, make them in pale gray rather than red. Because if they were in pale gray, that means they're faded out. So then a person really has a sense of what's missing.
Perfect. I will have this redone. I'm always changing. You start with a card and then you end up with
Yeah.
5 revisions. So thank you, Anne, very, very much.
So this place that I really want to remind everybody is, if you're not in a situation like Ted was talking about, he's writing these things. He needs to ask to have somebody from patient services come visit him and have them do what you need. That's what they're there for.
Oh,
Got it?
good
Patient
idea.
services is there to ensure that the patients are getting the services.
Excellent.
Jerry, hi.
Good morning. Well, no, it's afternoon, I guess. I got so confused with the time. Couple of things. First of all, Ted, there is a sticker you can buy that I put on my car that has that no hearing sign on it. And the sticker came with a couple different sizes. So the big one's on the back, and there's a little one that's on the window right next to where a policeman would walk up to me. So hopefully that would let them know that there's someone there that can't hear. But if I find one that doesn't know what it means, I'm going to educate them. Number 2, we're real lucky here in Colorado Springs to have a theater that on Wednesdays has open caption movies. And they have a big poster that identifies it, that on Wednesdays they have open caption movies, and they have I would recommend, if somebody wants to go to the movies, the Captive View, where you've got the silly thing in the cup, but you've got all your captions there. It's absolutely perfect. It's absolutely perfect. I mean, you can at least see what was going on and maybe what you missed and all of that. That's
You
what I
all
had
in
to say.
Colorado have done a bang-up job with that. Congratulations.
Thank you. Thank you. The open caption movies are just fun. I don't go to many movies unless they are on Wednesday afternoons or Wednesday nights. And the theaters fill up really fast, so I hope they keep doing it.
So Jerry, you mentioned something that I would like to elaborate about a little bit. So Jerry's in Colorado, and I don't know if you have it in Colorado, and we don't have it in California, but other states do have it. And it's a card that is distributed by either frequently by the Department of Motor Vehicles, by other agencies, that identifies you as a hard of hearing person and is like an infographic. And so if you get stopped by the police, I mean, the worst thing is, right, you roll down your window, then you have the background road noise coming in, so you can't understand the police person what they're asking you. So you tell them, I'm hard of hearing, I would like to get the card, and then the card is the infographic. They can point to things on the card, and I'd be happy to share that with you. In Missouri, I have a couple of different states that have that, examples of it, and I would like to have it in California. I think it's a wonderful thing. So Jerry, can you put your hand down? And who else is, what about people in the room? Are there any questions from the room?
Actually, I have 2 questions. First, under ADA, for ADA coordinator, I work for a private university. Do they have to, does the size of the company matter on having a ADA coordinator?
I don't believe so.
Okay, and my other question is, where are your meetings? Because my mom's in Lafayette, and I'd love to get her over to you.
Oh, perfect. So I live a little bit south of Walnut Creek, and your mother lives the other side of Walnut Creek, and we
Yeah.
meet at Rossmore.
Rossmore? Okay, I know exactly where Rossmore is.
Yeah.
So,
And so we meet the first Saturday of the month.
okay,
And we've also been attempting to do hybrid meetings. We hope the next one's the charm. We've had a little glitch every single time, but every time they're getting better.
all right. The first Saturday of the month in Rossmore. All right, thank you so
Yeah.
much.
So when I was understanding, and see, here's when it would be really good for me to have the full transcript up, because I missed a part of what was said there, and that was about the university. What did you say about a university? What school?
I work for Washington University in St. Louis,
Uh-huh.
and I'm just
And-
wondering if the size of the institution matters, if they need or are supposed to have an ADA coordinator.
Well, if you were asking that question in relationship to your university,
Yes.
the university is not a small place. Not only do
No.
you need to have an ADA coordinator, you need to have an ADA coordinator for all the students, which I am absolutely sure you have. And you also need to have some kind of coordinator for, so it's for everybody, right? So
Right.
the students need it. The teachers could need it. People who come to the university to participate in any kind of event the university had needs the accommodation. So it's you need a big department. And frequently the educational component is maybe separated from the other one, because the educational component is for the students. And there's usually a student disability office.
Yeah, I think there is a student disability office, but of course I'm staff, so.
Both
Well,
Washington
they're
University.
staff too. So that would apply to you as well. You would be an employee.
Right.
It has to cover everybody. So were you asking because it never dawned on you to think to ask for the accommodation that you need from your employer?
I never thought to ask.
Well, that's why I feel like this is probably the most important presentation I have ever given and continue to give. Because if you hadn't heard it, you would probably not even dawn on you, gosh, they're required by law to provide me with accommodation so I can do my job.
And this is Linda Baker. I'm very familiar with the ADA coordinators in the different universities. Washington U, which is private, and St. Louis U, which is private, each have ADA coordinators, but they're not very forthcoming. You really have to push to get what you need. Our state universities, a lot easier. WashU had a couple of suits against them. There was a profoundly deaf law student that had to sue what Washington knew. So knowing the history of WashU, it's been difficult.
Yeah,
Even
so-
though they have tons of money. If you're not familiar, Anne, WashU is considered the Ivy League of the Midwest.
So you guys need to make a big deal about that. And I generally believe you get more with honey than with vinegar. But when honey doesn't work, you have to speak up.
That's right.
And most of us generally aren't the most comfortable doing that. But if you don't do that, nothing is going to change. And if it's not for you, you're inhibited to speak up for yourself. You may have children. you may have grandchildren, you may have brothers, you may have sisters, you may have great-grandchildren. Every single thing that you do today will benefit everybody else behind you. And maybe that's the motivation you need. Whatever it is, try and find the courage to do that.
And I have a question in regard to theaters. And when I say theaters, I'm talking about live performance. We have 44 small live theaters in St. Louis, and there is no assisted listen devices for the small theaters because they struggle with getting money. A big one like Fox Theater, again, had to be sued to provide devices. Do you know of any small theaters that have pulled their resources so that assistant listen devices will be available to patrons?
Okay, so Linda, the first thing I'd like to do is I'd like to have you shift your language just a little bit, and I'm going to tell you why. I'm hearing you say assistive listening devices. So when I hear that, that means to me it's one-on-one. So a device is like a pocket talker. So what you're
Correct.
actually talking about is an assistive listening system.
System, yes.
Okay, so I have been in a situation similar to what you're talking about. They are not exempt. They are required by law to provide communication access, just like they're required to have a ramp for people with mobility issues. Now, some of the things, I got captions at our outdoor Shakespeare theater in the summertime through a grant from a local community foundation. So I would think in terms of looking at your community foundations. Look at the Rotary, look at the Kiwanis, local grantors. Because these systems, I mean, they're not that expensive, right? To be able, and in a small theater, they already have the PA, they already have the microphone. To approach it from that point of view. And if that doesn't work, file the complaint with the Department of Justice.
Yes, and I wanted to say my background is I worked as a disability rights activist and policy before. In Missouri, we have the Missouri Commission on Human Rights. So you can file a complaint with them and they would do the investigation.
So you have two options then. You have
Yes.
the Missouri
Yes.
Commission for Human Rights, and you also have the Department of Justice.
Right. We encourage Missouri Commission on Human Rights because they can expedite it much quicker than the Department of Justice. That's been our experience.
So in Missouri, are they required to investigate every complaint? Because with the ADA, they're not.
Yes, under the Missouri Commission on Human Rights, yes.
That's great.
And they have to do it in so many days. I can't remember how many days. Once you file a complaint, they have to investigate within that period of time.
So Harry had a comment for you in the chat. And I think Harry's from Illinois, maybe. I don't know. I didn't. Okay, so it says our state arts.
Nebraska, sorry, Nebraska.
Nebraska. Okay, so their state arts council gave a small grant to a small theater to defray the cost of installing a loop. And you know that depending on the size of the theater too, they also get tax benefits for providing accessibility. So you might want to bring that to their attention as well.
Thank you.
Yeah, Michelle, hi.
Hi again. I thought of a couple more things I just wanted to mention as you all were talking. One kind of frustrating thing also about the healthcare facilities when we talked about universities and medical centers. I just wanted to share that there's another very, very well-known medical facility in the Midwest that I'm not going to name right now, but as we were researching for our conference, we were going through a lot of the major healthcare facilities looking for these ADA contacts. So as I came across this website for this facility, it had an amazing, phenomenal website that was geared toward their staff and their trainees, their employees, because it's a teaching hospital. It's a teaching facility. So it had a wonderfully, well done website on accommodations for their students, but virtually nothing for patients. It was so frustrating. So I just wanted to share that. And then also, we have a wonderful performing arts center in our Fox Valley area that our local HLAA people advocated when it was first opened to have loops in it. They have a loop. They not only have a loop, they also have captioning on the Saturday 2 p.m. performance. And they also have Gala Pro. If nobody knows what Gala Pro is, that's another thing to advocate for. It's basically captioning that you can have an app on your phone and you can have captions right in front of you, but it's only for Broadway performances. But the other thing, okay, wait, let me finish my other comment, and then you can clarify, Ann, on that. But before I forget, the other thing that was enlightening to me when we talk about how we're learning and broadening our knowledge of other disabilities, I attended the Performing Arts Center's accessibility committee meeting last year. And actually it's been like a year ago now. And it was also very disheartening and shocking to find out that the mobility group is all over them because they do not have good handicap accessibility parking. And it is just so frustrating that I cannot believe, and I hadn't really even realized or thought about that before, but the handicap parking is like on a hill. And then when it snows, it doesn't get plowed. And these poor people coming out of their ramps, out of wheelchairs, are like on a hill. And it's just atrocious. So yes, there's still a lot of work that needs to be done. One last thing I wanted to ask about is in Missouri, I think you were just, kind of asking a couple of questions about state versus federal. And I just want to confirm and clarify that the ADA is federal. It's a federal mandated law. So I'm interested in what kinds of other things is it the compliance and the litigation that's done more specifically by state, or when is the state matter? Because my father right now is in Missouri. He lives in Missouri and he's in a rehab center right now. He was just in the hospital for a couple of weeks, and it was again a very bad experience. He has a cochlear implant. He's deaf without them. I'm so concerned that they're going to lose his implant. I unfortunately I did go down there for only like 24 hours. And now he's moved to a rehab facility, and I want to try and call and advocate for him to get something, even if they could carry around their little iPad and use captioning. But is there anything else that I can like quote from Missouri law or anything that would be beneficial and try, and which title is that? And you mentioned in the very beginning of this, title 1, 2, 3, 4, 5, where would health facilities or this rehab center fall within those titles?
Okay, so
thank you. I know that was a lot.
So Gala Pro is available to anybody who wants to pay for it.
Oh, paid. Okay.
Okay, it's a service, so you pay for the service.
Okay, it's free otherwise at our theater.
The theater pays for it.
Oh, okay.
The theater pays to install a hearing loop. The theater pays to install an FM system. The theater pays to have live captioners. They pay to engage with Gala Pro for their performances. They have a
Okay.
contract with them. Okay. The situation that you talked about in relationship to, you got confused about state civil rights laws and ADA rights laws. It depends upon the state. So in California, the state laws are more stringent than the ADA. So you need to, and one of the areas that it's more stringent is that they don't have any exclusions. The ADA has an exclusion. So if I were to advocate here for a place of worship, I generally wouldn't quote the ADA, I would quote the California Unruh Act because it doesn't exclude churches. So most state laws are modeled on the ADA, but can be more stringent. They can't be less.
That's good to know. Thank you.
Okay.
Do you know if Missouri, does anyone from Missouri know if if it's different than
Okay.
the?
What is your specific question about Missouri? Where about the healthcare facility? I'm a little confused.
No, she
Well,
was asking if anybody in Missouri knew whether the Missouri Human Rights Act is more stringent than the ADA.
They're about equivalent. It's just that they do investigations a lot quicker than the U.S. Department of Justice. So you mentioned your father in rehab. I will first find the ADA coordinator, but we have 22 centers for independent living in the state of Missouri, and they should have an advocate that could come and help you advocate for your father. What town, you don't have to tell me the facility, but what town or city is your father in?
I believe he's in Warsaw. They live in quite a remote
Oh,
area. So they're over in
That's
Warsaw.
that's very rural.
Yeah. So it's probably not a very big facility, I'm
If
guessing.
you Google Missouri Center of Independent Living, and if you know the county that Warsaw is in, it would tell you which counties that the Center for Independent Living are responsible for. If that doesn't work out, contact Paraquad in St. Louis and they can help you. Paraquad is the St. Louis Center for Independent Living. PARAQUAD.
Michelle, I have some other ideas for you. So you asked a question that hasn't been answered yet. So the rehabilitation center, you need to find out what the relationship is. Are they a standalone entity or are they part of the hospital healthcare system? What
Yeah.
is their relationship to? And that part of that determines, there's hardly any hospital in the United States that comes under Title II. And the reason they don't, Title III, which is just venues, because they get money from the federal government. So as soon as anybody gets money from the federal government, they move up to be Title II. So I recently have had 2 chapter members who ended up similar to what happened to your dad. And the first level of rehab that they went to, everything was exactly like what you're talking about. And their kids were bright, loving, caring kids, but it brought me to the next level of my own communication with my family, because I never dawned on me, if I were in a situation where I was really kind of out of it, either physically, mentally, whatever that was, my husband doesn't know how to put together the things that I need for my hearing. Prior to that, I'd never had him put my cochlear implant on. I never had him put the batteries on. There was nobody there to help her. And fortunately, I knew the kids. And so the kids invited me to come assist her. So she had this problem where she had hip surgery. She was reclined. She couldn't keep her processor on her ear. So I went with this whole nother level. So there are, for anybody who's here, there are retainers that attach to the tube, and they also have these for hearing aids, goes around your ear like this, and you can bend it up. There are headbands you can use that you slide the processor or the hearing aid into the headband. But we still had all kinds of problems. And what I went and talked to the head administrator for the facility, talked about the situation, and for the short term, at least immediately, we got whiteboards for the room. So so at least anybody coming in there, they had access to the whiteboard. I remember days being there with her, and turned out her processor was damaged. I had to get her a new processor from the company. I mean, it was a big deal, but the whiteboard was easy to get. Okay,
Yeah.
and they could purchase an FM system, and that should work for your father too, and that's not so expensive.
Yeah, I don't need to get into all the details, but he's been a very independent man for all his life. And before he got his cochlear implant, he read lips, used lip reading, and he is a phenomenal lip reader. So he probably may not even want assistive devices, but I would like to contact somebody
you
down there
only
just to make sure.
You only get 20% from lip reading.
Oh, he gets more than that. He is a phenomenal lip reader, really. But anyway, yeah, what you just said, Anne, though, is a very good, eye opener for all of us. And when I was down there with my dad, it was eye opening for me as well, because he actually had a seizure and his speech has been affected now also. So now not only can he not hear, and he's blind in one eye, and now his speech is impacted. So he's not speaking very clearly, and bring in me also with my hearing loss, trying to understand with the doctors, what's happening to him, and trying to understand him, and him trying to understand me. Oh my God, it was the blind leading the deaf, and it was atrocious.
Michelle, you should have asked for communication access for yourself.
I know, right?
I
do really well though, but it was understanding him. So that's another thing we also should be keeping in mind for our own self-advocacy, is teaching others how to put on our devices and how to charge them and take care of them, because nurses and doctors won't know how to do that. So hopefully a family member.
It would have been a huge learning experience for them to have you request communication access for yourself, so that you could know before you go, because you live in a certain life. You didn't know whether you'd be able to understand everybody, and then it would be too late.
I know.
They could have done all of that. So
I was only down there for 24 hours, and it was a weekend, and I figured by the time they do anything, it's going to be Monday, and I actually had to fly out of the country. So I had to get home.
I wasn't necessarily only talking about whether they could actually accomplish it. It's raising awareness that they need it.
Yeah. Well, I did. We were very vocal. I was very vocal about, all the other accommodations and things that he would need. Anyway, so yes, I want to follow up and try to get him more when he's in the facility he's at now. So I will do that communication.
Talk to you next week or whenever.
Sounds good. Thank you.
Yeah, I believe everybody has access to Ann Thomas's email. And I wasn't introduced because I'm at home right now. I just came back from Kenya, Africa, because that's not why I'm at the meeting room with Kathy. So I would like to wrap up this wonderful learning experience that we had. So if you got further questions for Ann, I'm sure she'd be happy to answer them through her email. And I really appreciate everyone joining us and learn more about HLAA, the different chapters that we have. Thank you for attending, and hope to see you next month. Next month, we actually are going to have someone to talk about ORCAS. You heard Ann kind of touched on that. Some of us want to learn more about it. So Kathy, I'm going to change it to you. Anything you want to add?
First off,
Can
let
we
me just check and make sure, were there any questions in the room? No, okay, you answered all our questions.
Kathy, wait a
Great
minute.
job,
We
Ann.
we have one question here. Jonathan, can you ask your question really quickly?
Hi, can anybody hear me? Okay, well, first of all, it's another question. My name's Jonathan. I'm the part of the HLAA in the Boston chapter. I met Ann a couple of months ago, and when I saw about this topic, no, you're right. I definitely had to be part of this meeting and able to hear your advice on your communication and among others. And it's something of where I have gone through, and unfortunately, I can't share them now because I'm still in the process of that. But it's just from what I realized, when it comes to ADA and then ask for a combination and so forth, and that's a very tough topic, tough subject to go through because not everyone has an understanding of what we have to deal with it in our everyday lives. But with that being said, it's gonna have to be up to us how we can make it work, what our relationship in our workplace, in colleges, universities, or wherever you are. But we're just so lucky right now that there's so many technologies that we can use to make our lives easier. However, again, this is a very tough situation to go through when you have to deal with the ADA because you never know if the ADA is going to help you or they're going to help the company or whatever's going on. So unfortunately, this is a very tough subject to go through. But all I know is that we're all together in this, and I'm glad to be part of this meeting, and we're always going to be there to help each other out.
Thanks, Jonathan. And I know that Linda and Kathy are concerned about the captioner because I believe it was through on the 30 minutes and we're past. So I think you're both trying to close the meeting. Am I right?
Yes.
Yes,
Yes,
because
but
Kim,
Kimberly
I
somehow
true-
got kicked out of the meeting, and so she's been trying to get back in, and I'm trying to figure out how to let her back in.
Yeah, Kim is already left and the automatic
Yeah.
caption is not working.
Okay,
Yeah.
so if you want to keep this going, I could stay for a few more minutes. Kathy, what you need to do is go into the settings for the closed caption and turn off the piece that Jean helped you with that you allowed to assign the captioner. Look at the menu bar. There we go.
There we go.
Run.
Okay, we got it now.
Okay.
Do
so
I need to repeat what I just said?
No, you're fine, Jonathan. You're fine. Okay.
Okay.
Some of our members that are in the room, I believe Kathy may want to leave. They have other commitments, but it's up to you, Kathy, if you want to continue. I have to get off myself.
We'll close the meeting. How about, can we communicate maybe, Ann, would you be okay with communicating through email with the rest of the people?
Okay.
He's fine, because I think it's been a long we've been on over an hour and a half now. And so I think we probably should close. The people here I know need to go, and Ann probably needs to go too. So thank you so much. Really appreciate seeing all of you. Hopefully we all meet together at the convention in June.
Thank
Bye-bye.
you. Bye-bye.
I'm going to end now. Bye-bye.